Hello, and welcome to Piecemeal. Welcome to a Between Bites Piecemeal episode. Piecemeal is a podcast hosted by the Emily Program, and Between Bites are short episodes addressing topics you want to know more about. Piecemeal covers topics related to eating disorders, body image, and how society may influence our thinking. Please use your discretion when listening and reach out for support as needed. I'm your host, Jillian Lampert, and for Between Bites, you get just me, no guest, but welcome. Today's topic is weight stigma and Weight Stigma Awareness Week. So what is all of that? Weight Stigma Awareness Week is created and co-hosted by our amazing colleagues over at the Body Equity Alliance and Within Health. It's September 22nd through the 26th. So coming up, you should be able to see more information about Weight Stigma Awareness Week at the website, which is weightstigmaawarenessweek.org. Weight Stigma Awareness Week basically features education, engagement, collaboration, and action opportunities to learn more, to get involved, to take action. But let's back it up a few steps and talk about what is weight stigma? Why is it so important that we think about weight stigma? And particularly, why the theme for this year's Weight Stigma Awareness Week is healing without harm, ending weight stigma in healthcare. And so why do we need to think about it in healthcare? So let's take those step by step. What is weight stigma? Weight stigma is essentially the way that people are treated by others or even by themselves based on a judgment about weight, body size, or body shape, body appearance. Weight stigma is really judging somebody and acting upon that judgment in a way that diminishes somebody, diminishes respect for people, diminishes the way we interact with people based on our perception of their weight. And we live in a really body conscious society. We live in a society that tells us a lot about what we should look like, what our bodies should look like, how much they should weigh, how we should change their weight, how we should think about changing the way we eat, the way we move to influence our weight. And all of that kind of comes together to result in weight stigma, which is the judgment that we have for people who are in larger bodies. And you can see this in all sorts of ways. Unfortunately, you can see this in our media and how we use people who live in larger bodies in positions or in characters in TV, movies, or other media opportunities, how we use characters who live in larger bodies in ways to be comedic, in ways to be sort of degraded, in ways to be kidded about. We make fun of people in larger bodies, and that's not okay. It's when you look at it in media, you hear people make jokes about people's body sizes and shapes. You hear people make jokes about their own body size and shape or weight, and we see it woven into the fabric of our society, and it's part of what makes it really hard sometimes to recognize weight stigma. The bottom line is we should treat people with respect because human beings deserve respect no matter what their body size or shape is. We should treat each other with respect and kindness because we are humans, and we shouldn't have that be predicated upon what size our bodies are. And we see this weight stigma play out in many ways over many different settings and different environments. And it's part of why the theme for this year's week is healing without harm, this ending weight stigma in healthcare, because there have been a number of studies that have looked at weight stigma in healthcare. And it turns out that there is, very unfortunately, a significant amount of weight stigma in healthcare. And we see that when we, look at research that asks healthcare providers, what they think about taking care of people in larger bodies. And you can see it across different kinds of healthcare providers, doctors, dietitians, nurses, therapists, across the types of different healthcare providers, that people are less comfortable taking care of people in larger bodies oftentimes. And more reluctant to engage with people in larger bodies in a really more holistic way about their health. They tend to be focused on weight instead of holistic health. And we hear this a lot from clients seeking care for an eating disorder, but we also just hear it from people in general that people who live in larger bodies go to the doctor for whatever reason, and that reason tends to be overlooked or overshadowed by a conversation about their weight, even though their weight is not at all what they're there to talk about. And the presenting problem that they're there to get help with in this healthcare visit, really the approach to helping with that healthcare issue has nothing to do with their body weight, but their body weight becomes the topic of conversation or the area of focus. Like if somebody goes in for a sprained ankle because they were doing some activity and they sprained their ankle and they go in for services related to the sprained ankle, that in theory, the conversation should be about the sprained ankle, right? A lot of times people who live in larger bodies will report those kinds of appointments in healthcare settings, which should be about the thing, like the sprained ankle, become about their weight. And even though they're not there to talk about that and their weight isn't what led to their ankle being sprained, they end up experiencing a conversation about their weight as they're getting care for their sprained ankle. And more distressing, we hear many stories of how the thing that they present for, like the sprained ankle, gets overlooked and really sort of almost ignored or really minimized in lieu of a conversation about their weight or about weight loss. And so we see a lot of folks who end up seeking care for an eating disorder who often will have a story or many stories, unfortunately, about trying to seek healthcare, trying to seek preventative healthcare, and experiencing so much weight stigma and so much relentless messaging about weight loss that they end up deciding to just not go to the doctor. They end up deciding to not get the healthcare they need because it's so overwhelming to them to continue to be encouraged or instructed or educated about weight loss instead of the thing that they actually came in to the appointment to talk about. So it's really important to think about weight stigma in healthcare. And I want to really emphasize that our healthcare education system is set up to have us focus on weight and weight loss in many situations. And that's pretty unfortunate that I'm trained as a dietitian. A number of healthcare providers, dietitians, physicians, nurses, folks that are dealing with medical healthcare are often trained to think about weight. And we really want to think about how could we do that much more holistically? It doesn't conflate weight and health. It doesn't equate weight and health. That when we think about health, we really want to think about a much more holistic picture. How is somebody sleeping? How are they coping? How are they moving? How are they eating? What's their community of support? What are the other impacts on their health? And that's so much more. It's so much more um, in depth and varied than anything that could be just tied to weight. And so instead of having this varied, robust, rich discussion about all of these impacts on health, oftentimes people experience just a sort of one message around weight loss. And healthcare providers are in many ways sort of trained to focus on, okay, here if somebody's in a larger body and their weight is higher than whatever table says it would be better to be at, they get the educational focus to really counsel that person on weight loss. When again, that could be not at all what that person is seeing that healthcare provider for, and may not be at all what that person needs. So it's really important to think about weight stigma in healthcare because frankly, it keeps people from getting healthcare. And they deserve to get healthcare. So how do we end weight stigma in healthcare is really a big part of this conversation for Weight Stigma Awareness Week. And I really do hope that you'll check out the Weight Stigma Awareness Week website and see what sorts of pieces might appeal to you in terms of education or engagement or collaboration or action, because we end it by working together. We end it by learning more. We end it by supporting each other. We end it by really encouraging our healthcare system to think much more holistically. And we end it in small ways and in large ways. We end it in day-to-day ways. That if you are around a group of people and somebody makes a joke or a comment that degrades somebody who lives in a larger body or makes a comment about somebody's weight, say something. If you can stand up in that moment and say, hey, it's not okay to make fun of somebody because of their body size or shape, or that sounded like a really, weight stigma laden comment and sounds like a really judgment filled comment. How about if we don't do that? How about if we don't judge people based on their appearance? What if we didn't talk about people that way? That's not kind. It's not respectful. It sort of violates all the things that we learned when we were, young children about being kind to each other. Makes me think about the preschool that my now 21-year-old went to and how they taught the kids to be kind and respectful. And if we can't be kind and respectful as adults, we need to remember that lesson from preschool. How can we be kind and respectful and not make fun of people based on their appearance or their weight? That's one way we can end it. We can say something. And we can also educate. We can educate people why weight stigma is dangerous and why its impact is very strong on people's health. There's actually some really, really interesting data that show that impact on people's health of being stigmatized because of their weight is just as or more impactful as the impact on their health from things related to their body size and body function. That the actual impact of being teased, the impact of having their bodies be stigmatized is so impactful, negatively impactful on their health. That's something we can do together. We can stop being unkind and disrespectful in lots of ways, but particularly when it comes to people's body size and shape. So that's one of the ways that we can end it. There's a lot other ways that we can take action. I encourage you again to tune into Weight Stigma Awareness Week. Check out what's on the website there, and think about, if weight stigma has impacted your ability to get healthcare, just know you are not alone. There is support. There are really well informed providers out there. There are some really great resources out there that can help you to get connected to a healthcare provider that will really take you into account and not reduce you to your weight or size or shape. If you are a provider, please consider how weight stigma is impacting your practice. Think about how you respond when you see somebody who is in a larger body. What are your first instincts, and are those instincts the same as they would be in somebody in a smaller body when someone is presenting for something like a sprained ankle or a spider bite or a respiratory illness, whatever it is? How might weight stigma be impacting your practice? There's a great implicit bias test you can take that's online, that's available as part of a study that's ongoing. There are a number of ways you can learn more. So take a few minutes, check out that weightstigmaawarenessweek.org website. Take a few minutes and check out the resources we have on the Emily Program website. But learn more, educate yourself, and learn a little bit more about how weight stigma can impact all of us. That's all the time we have for today. Thanks for listening. And if you enjoyed today's episode of Piecemeal, please subscribe, rate, or leave a review on Apple Podcasts or wherever you listen. Learn more about us at emilyprogram.com or find the Emily Program on social media. Piecemeal is produced by the amazing podcast team at the Emily Program. Until next time, take care. Thanks for listening.